everyone. Today we will discuss regarding hemolytic uremic syndrome, the key facts of hemolytic uremic syndrome. What happens in hemolytic uremic syndrome? Hemolytic uremic syndrome is a condition that is commonly infectious in origin, and it is commonly caused by Shigella organism, and even more commonly by E. coli, that is enterohemorrhagic type of E. coli 150 O157S7 strain. So O157S7 strain that elaborates Shiga-like toxins, and that is believed to be damaging to the endothelium, causing marked damage to the endothelium across, and that causes microthrombi formation. So microthrombi formation, and the common precipitating event is some kind of a GI or respiratory infection very commonly. So some any kind of a GI or upper respiratory infection commonly leads to this kind of a precipitation by E. coli. So GI infection could be because of the infected hamburger or undercooked beef. That is one of the common mode of infection in patients of HUS. Sometimes respiratory infection can also cause this, and respiratory infection like streptococcus pneumonia can also be the cause for this. And this HUS will cause marked endothelial damage, particularly affecting the glomerular capillaries as well as the arterioles. So there is a marked renal damage, microthrombi formation, and causing renal failure. It can lead to acute renal failure in many of the cases, many of the child. Typically, it is more commonly seen in children, and here there will be even high-grade fever, infective in origin. So there will be fever, there will be platelet consumption in the thrombi formation, there will be some depletion of coagulation factor. So it may result in deranged lab tests like PT, APTT may be deranged. There may be slight derangement of that. Thrombocytopenia is generally moderate to marked thrombocytopenia. Signs of mucocutaneous bleeding may be manifested, and markedly diminishing renal function is the important thing. So here the most important feature is not to most important management is not to treat the infection with antibiotics, because that may cause lysis of the bacterial wall, causing release of endothelium, release of the bacterial endotoxin further into the bloodstream, and that can cause further damage to the kidney. So there may be precipitation of acute renal crisis even with that of antibiotic use. Even antimotility drugs are also not used commonly. So I am talking about hemolytic uremic syndrome. So I'm going towards that, Nishant. Yeah, I'm good. Thank you. So hemolytic uremic syndrome, I am talking about the management that antibiotics are contraindicated because it causes bacterial lysis, leading to release of endothelial toxins, and it will cause further damage to the kidney. And even antimotility drugs are not being used because it will delay the flushing out of the toxin. So both antibiotics as well as antimotility drugs are contraindicated in HUS, and generally we use symptomatic therapy. Symptom-based therapy like fluid and resuscitation is commonly used, and the acute renal failure and other complications generally resolve with the resolution of the infection. That is the common thing. In some rare cases, some eculizumab may be used, and some other kind of a treatment, plasma exchange may be used. And so plasma exchange and eculizumab particularly may be used in atypical HUS. So atypical HUS means what? Atypical HUS, there is a typical HUS that we discussed so far. 95% of the cases are typical HUS. Atypical HUS means the HUS occurring with that of the complement dysfunction. There is no infective etiology, there is a complement dysfunction. So complement dysfunction leads to abnormal activation of the complement and leading to endothelial damage. That is called as atypical HUS. So there is no infective etiology being seen over here. So here there are some monoclonal antibodies with like eculizumab, which can be directed against the C5 complement, and which can prevent the complement activation. Particularly the alternate pathway of the complement activation takes place over here. So to combat that, eculizumab is used. So majority of the cases of typical HUS have a good prognosis, whereas atypical HUS may be difficult to control and are having a poor prognosis. Now, how would you distinguish HUS and TTP? Important thing to distinguish between them. HUS will have more of renal failure. Neurological signs and symptoms are quite lacking over there, whereas in case of TTP, the predominant signs and symptoms will be neurological signs and symptoms like delirium, convulsions, and all will be there. Whereas HUS generally does not have neurological feature, more of renal failure, and commonly seen in children. So that's all about the HUS and TTP. So any queries regarding HUS and TTP you would like to ask, you can ask me that. Any queries regarding HUS and TTP? HOS is a very high topic, hemolytic uremic syndrome, and it is invariably asked in various kind of MCQ, in various kind of exams like NEET PG, USMLE, or in your MBBS professional exams. It commonly comes as a short note. So you should be very well versed with HOS. So if you have any HOS related queries, you can ask me now. Okay, so thank you for your kind attention. Thank you for attending this live presentation. So this is a new addition in YouTube with a vertical live streaming. So I intend to do more of live streaming. You can also follow me in Instagram as the same channel, that is Pathology Navigator over there, Instagram and Instagram thread as well. And I keep on posting lots of polls over there in Instagram and Instagram thread. So keep you can join me over there in Instagram thread, YouTube. You can download our app, that is Pathology Simplified, and that is having lots of stuff, academic stuff, and you have lots of paid courses, and some free courses are also there, and you can have a great learning over there as well. That the app name is Pathology Simplified, and it is listed in Play Store, and even in the App Store you can download that. You can download the Class Plus app, and then you can download with the institutional code, that is ISFSD. I repeat, ISFSD code is, you can just have to put the institutional code, then you will come across the Pathology Simplified app. So there you can get access to our courses. So thank you for attending the session, and I would be ending the presentation regarding the HUS now, and would like to discuss with you again, would like to catch you again in another live presentation. You can message me if you have any requirement regarding pathology teaching for crash courses, or if you have any requirement regarding the regular coaching in pathology. So we have various options for that. So please contact us for that. Thank you for now. So now I'm starting a poll. So to end up, I'm just having a poll. Just let me see how you have understood HUS. Just allow me 2 minutes. I will be there ready with a poll. Yeah, so I have posted a poll. HUS is commonly caused by, so you need to answer that. You can let me know what is your answer. It will be open for next 2 minutes. Please click your answers. Then we will discuss which is the common organism that causes HUS. Please mark your answer. The poll is open. Just 1 minute to go. Please mark your answer. Please mark your answer. What is your answer? Okay, so HUS is commonly caused by E. coli 157 O 157 S7 strain. So Shigella is there in the option, Pseudomonas is there, Staph aureus is there. So if you are asked regarding this is a very commonly asked question. So this HUS is always caused by O157 S7 strain of E. coli. That is the common organism. It elaborates Shigella-like toxins that is quite mimicking to that of Shigella, but it is more commoner than Shigella organism itself. So it is the answer is E. coli. That is the common answer over here. So thank you for attending the session and participating in the poll. We'll catch you up in the next session. I'm just ending the session now. Thank you.